Value is more than just a great price. That's why this segment is brought to you by Pick n Pay.
Now, about 3.3 billion people, that's half of the world's population, are at risk of malaria. In 2010, there were about 260 million malaria cases reported. And before going away on holiday or business, it's very important to find out whether there is if you're going into an area where you can get at risk of getting malaria in the area that you're visiting. And that's why Fransa Katz is with us from Pick n Pay Pharmacy. Good morning. Welcome to Expresso again.
Thank you.
Now, how do you know whether the area that you're going into might be a malaria risk area?
Go and see your pharmacist. Pop into one of our Pick n Pay pharmacies. We will have a map up, and the pharmacist will be able to tell you which is a high risk and which is not such a high risk. And that knowing which area is high risk or low risk will depend on what you have to do when you go to that area. So you have to make sure whether you are going into an area like that. So come see one of our pharmacists.
Now, what are the preventative measures if you're going into a high-risk area? And how does it differ from a low-risk area?
Low-risk area, you can often just use, mosquito repellent that you rub on your legs, use a mosquito net that you can use over your bed when you sleep, and things like that. You don't have to take medication. When you do go into a high-risk area, you have to get specifically prophylactic medication to help prevent malaria, and that you can only get from a doctor, because your doctor has to look at your age, he has to look at the fact whether you are taking any medication currently. He looks at your medical history, and from that he will decide which medication would be the best for you to take. So you have to then go see your doctor, discuss with him, and then you can pop into one of our pharmacies and speak to our pharmacists about what else you can use. As I said, mosquito repellents, they will tell you everything, and also as to the side effects, what you can do to minimize that. Most important, I would like to mention, is that in my experience, I've noticed that a lot of people are very good when they go.
Yes.
They take their medicine, and while they're there, they take it all the time. But most of the prophylactic medication for malaria, you have to continue with it for about 4 weeks after you've left the area. And that is when a lot of people, it's not nice to take tablets all the time. And about a week or so afterwards, it's like, I'm not there anymore, so I don't need to take it anymore. And you have to take the whole course of medication.
Very, very important.
Very
now,
important.
I was in a malaria area with a whole bunch of journalists last year. We were in Zambia, and we were all had very bad side effects from your medication.
They do have pretty hectic side effects.
And that's why a lot of people stop taking their medication.
That's the main reason why, especially when you're home, you don't want to still feel nauseous or not feel well. So thinking that I'm not going to be bitten by a mosquito now, so I'm not going to take it. But you actually have to still take it for, some of them, up to 4 weeks.
Now, what are the signs and symptoms that you might have contracted malaria?
If you were bitten by an infected mosquito, when you come home, you normally would have symptoms from about 10 days, but it can be up to 4 weeks before you show any symptoms. And usually it is similar to just a bout of flu. Headache, chills, fever. So if you've been in a malaria area recently and you do feel flu-y, rather go have a check, go to your doctor, they do a blood test, and rather get the results saying, no, you don't have malaria, it's just flu, instead of not going thinking it's flu.
Absolutely.
And it's actually malaria, because the quicker malaria is diagnosed and treated, the better the outcome of the disease.
Well, Fransa, thank you so much for joining us,
pleasure.
answering our questions here on World Malaria Day. If anyone wants to contact you on Twitter, it's Fransa Katz.
Yes.
On Twitter, and you can ask any questions you have to Fransa, and she'll be able to answer your malaria-related questions.
Stay with Expresso and SABC3.